everyone. Dr. Ray with Olive Branch Wellness Center here. Today I thought I would share a very special person with you, Dr. Carolyn Karwoski. Dr. Carolyn is the owner of Karwoski Family Vision in Winfield, Illinois. And Dr. Karwoski is going to tell us a lot of information about the eyes. The eyes are very important in your health. And I get a lot of question about eyes, and I would love to give you some information. So right now, I'd like to take you right over to Dr. Karwoski. Good morning. How are you?
Good morning. Good.
Good. So I do get a lot of questions from patients about what happens when they go to the eye doctor and what happens in the back of their eye that the eye doctor is actually looking at. So I thought it'd be a great way to bring you in today and give us some information about what goes on in the back of the eye, or as you and I know it, that we look through aqueous humor, we look through vitreous humor for those of my viewers who like the big words, and we look at the posterior portion of the eye. And I want you to go ahead and give our viewers some information about some actual diseases that you actually see before they actually know that they're there when you look at the back of the eye.
Yeah, some of the things I look for in the back part of the eye, look at the nerve to see if there's any neurological problems like multiple sclerosis, a brain tumor, glaucoma. I also look at the blood vessels to see if there's any vascular diseases going on like diabetes, high blood pressure, high cholesterol. I also see if there's macular degeneration. So many of those things I can detect before they even know they have it. So I've had patients come in that are complaining about blurry vision, and then I look at the back part of the eye and it ends up they have diabetes. So so many of those diseases I can take a look and detect them before they even know it.
That's great, and then you refer out to their primary care physician.
Correct.
For the entire body care, but you will take
Right.
care of, so to speak, the diabetic eye.
Right.
Now,
That's
I
correct.
wanted to go ahead and ask you, because I get the question a lot, and since I don't have eye care as part of what my specialty is, and that's your job.
Right.
When somebody begins to take good care of their body, get their diseases under control, do you see reversal of some of those vascular issues in the back part of the eye?
Yes, I do. With like diabetes, you know, if we see bleeding back there, it can actually be reversed. If they're having a healthy lifestyle, supplementation, losing weight, things like that, that can actually be reversed. It also depends on what stage they're in, you know, for diabetic retinopathy,
Right.
which is bleeding of the back part of your eye. So if it's in advanced stages, sometimes the vision can't get back to normal, even though, you know, you're changing your ways and all
Right.
that. But in most cases, in early diabetic retinopathy stages, it can be reversed. Yes.
Well, and that's good. Now, is that only for diabetes, or is that for hypertension? I know we've been taught that you'll see feathering, which is that bleed out effect. Does that reverse itself? Can you see a reversal in the back part of the eye?
Yes, you can also see it for a hypertensive retinopathy, which is bleeding of the back part of the eye.
Okay.
Yes, so yeah, you can definitely see it for that as well, for other diseases.
Great. So you're a firm believer then in, I know, well, I've been in Dr. Carolyn's office. Dr. Carolyn is a firm believer in supplementation and healthy lifestyle. And so I know she also is a firm believer in, if she has to give drops for the eyes, she also uses natural drops too in your clinic.
Yes.
And homeopathic drops, which there's a difference, as we all know, between natural and homeopathy. But some of the other things that I think are very interesting for people is they want to believe that it's okay, even if they're straining their eyes, that it's not going to change their vision. Is that true?
If they're, you mean like whether or not they're wearing glasses?
Yes.
You know, yes. So
Yes.
many people think by wearing glasses, you know, it actually will make their vision worse, or not wearing them. But no, wearing or not wearing your glasses won't physically damage your eyes. The glasses are just a tool to help you see better, so and alleviate some of those symptoms, you know, eye strain, headaches, things like that. So there's no harm in wearing the glasses or not wearing the glasses. Now, it's very different for children. Children, definitely, they have to be wearing their glasses so that proper development occurs. But for adults, there's no harm.
Okay. So you had mentioned something to me earlier today about some brand new research that is on the cutting edge, a little bit about the lens of the eye and Alzheimer's.
Yes. Yeah, there's new research that maybe we can see changes in the back part of the eye, and that could be a sign, an indication that maybe the patient has Alzheimer's. Yes.
So you heard it here first. Get in to see the eye doctor, especially your parents, your older parents. If you think you're having troubles, get them to a qualified eye doctor like Dr. Carolyn. There'll be a link on my website, of course, for this, but Alzheimer's isn't anything to play around with. At this point in time, millions and millions of people are affected with Alzheimer's.
Yeah.
So wouldn't that be great if just doing something simple like getting an eye exam can tell you whether or not you may have a tendency. So I don't want letters, I don't want phone calls, nasty emails. It's just in the early stages of development for this information. Let's touch on something else. Sunglasses. Now, I have always heard that lighter-eyed people, blue or green, have more reflection in the back part of their eye, so what they're seeing as bright is blindingly bright to them, whereas it's not for darker-eyed people. Is that true?
With lighter colored eyes, those patients will be more sensitive to the sunlight. So they definitely do need more protection when it comes to sun wear. But yeah, sun wear is actually very important to have because it protects you from those harmful UV rays that can cause cataracts, macular degeneration, pterygium pinguiculus, which are actually growths that appear in the front surface of the eye, cancer around the eyelids. So that can, that is very important to protect your eyes from the sun.
Now, what is the difference for John Q. Public going to the local drugstore and purchasing sunwear versus coming into a qualified healthcare professional like yourself and getting a good pair of sunglasses? Obviously, people are saying, well, there's the $20 ones and then there's the $200 ones. What is the difference?
The difference is that the cheapy sunglasses, they're not going to protect you from all the UV rays. There's UVA, UVB, UVC, so there's a bunch of different UV rays.
Okay.
So they're not going to cover it, it's not going to cover all the UV rays. Whereas if you come in and get, a prescription pair of sunglasses, they're going to cover all the UV rays. So you want to make sure that the sunglasses say UV 400 on the sunglasses. There's also now sunglasses that actually protect you from blue light, or glasses that protect you from blue light, and that's something very new right now when you're on the computers. Fluorescent lighting is that actually can cause macular degeneration in patients who have low levels of vitamin C and antioxidants in the blood. So that's very important also to have protection from the sun for patients like that.
Now, also, when we're talking about sunwear, a lot of people will get those funky little glasses and put them on their kids. How is that good, bad, indifferent?
For kids, it's very good to have sunwear protection because especially most of the sun damage actually occurs before the age of 18. So it's very important for kids to be wearing sunglasses, but you do want to get a good pair of sunglasses. I mean, also for adults that wrap around more, give you more protection versus something.
And they do have a lot. I've been to Dr. Carolyn's clinic. They do have nice ones that don't look like orthopedic wear for the eyes. They do have nice sunwear over there. But it's important to protect your eyes. One more topic before we close out for today. How does being overweight affect your vision and the health of your eye?
That can definitely have an effect on your eyes. I mean, if you're not living a healthy lifestyle, that can cause cataracts, diabetes, high blood pressure, and then in turn, it can affect your eyes as well and cause vision loss. With cataracts alone, I mean, there's research that shows that one of the causes of cataracts is oxidative damage in the lens. So those protein and enzymes are damaged, and so then it's good sometimes to have antioxidants or good supplement, eating healthy, and that in turn can prevent some of that damage in the lens and prevent cataracts. So it can definitely prevent a lot of other diseases that can happen in the eye.
Good. Well, all of you people who have been wondering why I harp so much on taking your supplements, if you won't do it for me, do it for Dr. Carolyn and your eye health, because there's going to be nothing that will replace your vision in the future. I don't care what it is you think we're coming up with scientifically, we cannot replace your vision. So this is Dr. Ray with Dr. Carolyn from Karwoski Family Vision telling you keep your eyes checked up on. It'll serve you best. And remember, come and see both of us. Thank you.